Good afternoon, everyone, and welcome to the November 19th meeting of the Allen County Board of Library Trustees. Glad to see everybody on here. I'm just taking a count here real quick for those watching. Thank you for joining us. We're waiting for all the board members to connect up and make sure that we have a quorum present right now. Waiting on Sharon Tucker, I believe. I did talk to her and she said she will be here, and I wanted to allow her to run the roll call vote. So we'll just wait another minute or so here to see if we can't get Sharon on the call. And if not, then we will we'll proceed with that and I can run that part. I want to take this time on behalf of the Board of Trustees to thank all the staff at this time. I know there's been a lot of conversation around all of the new COVID information that's coming out, the rise in cases, things along those lines. And we just want to continue to thank you as staff, especially all of you in the front lines who are, making sure that people get the resources they've ordered, that they want to get out or that they need for school and things along those lines, and have really worked hard to make all the virtual programming happen. We know that you all are working very hard to pivot, and I just think we can't say that enough, and it'll probably come out a few more times in this board meeting before we're done from other board members, but I just want to make sure that you know that we appreciate you, and we are, I know, talking today a little bit about some of that and how we might have to pivot for a short time, maybe again, about what that looks like, but we're just grateful for everything you do every day on that end. So I'm going to go ahead and begin the meeting. Again, with this being a full virtual meeting today, we will do a roll call vote for all votes, and I will record those, or actually call for them until Sharon gets on the line here to maybe take over whenever she does. So for right now, for quorum, if we could do a roll call vote on that. I'm obviously present. Ben Eisbart.
Present.
Paul Moss.
Present.
Jim on here? I thought I saw Jim.
Present.
Oh, there he is, Jim Williams. There you go. Got your camera off. Okay. Gloria Shamana. Gloria, you might want to, you have to unmute on the bottom left. There you go.
I'm here.
Excellent. Thank you, Gloria. I was going to say, we can see you, but we want All right, Marty.
I'm here.
Marty Seifert. All right. And currently, Sharon is still absent. Oh, Sharon, you're on now. I see her coming on. Sharon, if you want to unmute yourself and make yourself known, that'd be great. Hi, Sharon. Can you hear us?
I can. Can you hear me?
I can. Great. Glad to have you on. So we have a full board today. So thank you all for taking time to do that. We are good to go on roll call. And I'll move on to adoption of agenda.
So move.
Second.
Motion by Gloria, a second by Jim. Discussion at this time. I would like to add in under other business, we have a small designating purchase. We need to designate Denise a purchasing agent for the library, and we'll explain that a little more when we get to that point under other business. But I'd like to add that into the agenda today. Are there any other additions or corrections at this time? Seeing none, we'll move forward with the roll call vote.
And I will do that.
Thank you.
Gloria,
Here.
Jim.
Yes.
Aye.
I'm sorry, I'm writing this down as I told. Ben,
Yes.
Paul.
Yes. Yes. Sorry.
Oh, there we are. Marty.
Marty, you're
And
muted.
Marty's on mute. And Kent.
Aye.
And Sharon is an aye.
All right.
We didn't get Marty. He may have had to step away, but that's okay. We'll come back. So right now we have 601.
All right, thank you. Motion carries then. We'll move forward with the approval of minutes. Is there a motion for approval?
I'd move the approval of the minutes of October 22nd, 2020.
Second.
Okay, motion by Ben. We'll do second by Sharon. Sharon, if you could proceed with the, are there any corrections or additions to those? All right, seeing none, we'll ask Sharon to move forward with the roll call vote.
Absolutely. Kent,
Aye.
Jim,
Aye.
Gloria,
Aye.
Ben,
Aye.
Paul,
Aye.
Sharon will be an aye, and Marty, have you joined us? 601.
All right, thank you. All right, finance report for October 2020.
All right, thanks, Kent, and good afternoon, everybody. Obviously, in your packet, I've sent out the financial reports, and then a few minutes ago, I sent the check registers for today. Main thing, we've got a long agenda, so I won't go into too much detail. Just a couple of lines, which is typical of this time of year, that will need some adjustment at year end. One is the legal line. We've had a bit more in terms of not only contracts, but other, as the COVID situation, we've had Pete's bills. We also, what I didn't mark on my report though, the more important are the bond issue costs. I mean, if you recall back in May, June, when we were going to issue bonds, there were legal costs on that. So not extremely amount, we'll just make an adjustment at year end, which really is another news note. We're coming up to year end, hard to believe. Although I would really like 2020 to be ended, and I don't want to revisit it anytime soon. But we'll be bringing budget transfers to the board in December. I don't anticipate a lot of them, just because, as you can see from the graphs, spending has been very much reduced this year because of the closed time during the pandemic and the modified processes. So. But I'll be bringing those in December. The only other line I note is unemployment reimbursement. We've had a couple of people file for claims, and it's only a $5,000 budgeted line, so you get one person or two claiming, and it puts it in there. But we'll adjust that later. Main thing that we see coming up is obviously with what we're going to talk about later with the increase in the code red now pandemic. I've already talked to Kim Quintrell. We're probably going to need to move some more money into the electronic resource area, but just because those are so popular when we have to go into a shutdown situation or a curtailed service situation. So, but I'll bring those in December. As far as other items, everything went through fine on the budget filing. They've been filed with Gateway. We'll just wait for DLGF for their approval by the end of the year. And we're just starting in with our year-end processes as usual in staff in the accounting area. And then the last thing is, as I mentioned in there, we're getting ready to do the facility master plan RFP, and I'm sure we'll talk about that later, but that'll be a big one. And we're looking forward to getting that out and getting information so that the Capital Projects Committee can continue on with the work on the, potential, modifications and enhancements to the facilities. So amazing how much I can talk sometimes, but whatever. I'd be glad to answer any questions at this point, if anybody had any.
Any questions for Dave?
Any update on tax revenue projections farther out and all that?
Yeah, I'm glad you asked that, because that was one of the notes I had here. Yeah, obviously the main item we're looking at and keeping an eye on right now is we'll have a preliminary amount of property tax collection for the fall collection coming out next Friday. Nick will be sending that out from the auditor's office. That'll be an indicator for us that we're keeping an eye on how property tax collections will go this year. Obviously, we haven't heard a whole lot change there's been no numbers change at the state level regarding income tax. That's the other main one we're looking at. But we know those are going to go down. There's just no way around it. So we're just going to keep watching them, and we've got the flexibility in the budget to adapt if we need to. But I think right now, property tax looks pretty good. I mean, this year. Keep my fingers crossed on that. And since it's our main revenue source, that's the one to watch. But I'll let you know as soon as that comes out. I can send an email out how they looked after Friday and see what the preliminaries look like, how it differed from last year.
Yeah, if you could, I'd be interested if you could forward that on. I used to get those, but I think it took them maybe 8 years to realize that I was no longer on council, so I don't get those emails anymore.
Sure. Yeah. Yeah. And you know, Paul, a lot of them, you know, Nick has it right now on his website. A lot of the, you know, is just transparency. So any of the tax distribution reports, any of the, and he's got it broken down as far as property tax, excise, FIT, income.
Okay, if he's gonna put it out there, I'll just look there. Yeah, that's
Yeah,
fine.
just go to the auditor's website on the county website, and he's got a ton of information out there. He's done a great job at doing transparency and putting those reports out there.
Yeah, okay, thank you.
Sure.
Hey, Dave, just one question, and I know that I don't think we're talking about the capital committee here anytime today. We had talked about in the capital committee, and you kind of referred to the capital plan when you were talking. So I know we were talking about an RFP that was being worked on to help with that process. Has that been moving along as well?
Yeah, in fact, we have Pete has looked it over. We just got that red line version back from him for the RFP. I believe Denise and Kim and I are meeting on Tuesday to go over a final before that gets put out for publication and obtaining. So I think and Denise, correct me if I'm wrong on that, I think we're still on track for the timeline we discussed in the last committee meeting and having information back to that pretty quickly.
We're probably off by a week or so because it'll be delayed because of the holiday as well, getting it posted to the website. But I think within a week or so of what our original projection was.
Okay.
So you might get it. We hope to get it to you by the end of January, but it might be the February meeting before we have proposals and a recommendation.
Okay, great, thank you. All right, are there other questions at this time for Dave or the finance report? All right, seeing none and hearing none, I'd like to have a motion for approval, please.
So moved.
Okay.
Motion by Jim, second by Gloria. Are there any further discussions or questions? All right, Sharon, please proceed.
Ben,
Aye.
Paul,
Aye.
Gloria,
Aye.
Jim,
Aye.
Kent,
Aye.
Sharon is an aye, and I don't see Marty on anymore.
No, he had sent a message that he had to step off for a little bit, so maybe he'll come back on in the meeting again later. So, yep.
All right,
All right, motion
601.
Thank you. All right.
That's cute.
Do what, Gloria?
Well, someone had to put some things on my desk and is crawling to my desk so that they don't appear online.
Well, you could see the door open and close.
I know, I'm thinking, what? I'm hearing this little crunching or something. I'm thinking, what?
And it's wonderful that we can laugh even in today's
I agree.
society. So
I'll thank her for that laughter.
Yeah, that's exactly right. So, all right, let's move on to approval of claims.
Yeah. I sent that out earlier, and you know, the one modification I'd make is I had Jill combine those registers so that, you know, these actually have payments since November 2nd on them. So the ones that we would have normally faxed out to you on November 11th, we've just got them here added in here since it was just a week. So that register has all of the claims for November. And as you can see from the high dollar amounts, I mean, the main items are insurance this year, and then ebooks, audiobooks, the high dollar ones, the usual ones. We are seeing some capital items. I know I'm working with Jake on getting a lot of those things, trying to get finished up before the weather turns really bad. We were lucky that had that spell of good weather where we were able to get the parking lot work done, the asphalt and the lining and things like that. So I know the big projects right now are chillers at the main. Seems kind of weird that you're heading into winter and you're going to put in chillers, but hey, that's the best time to do it, I guess. You don't need the cooling. So those capital items, and those were the ones that we had been earmarking for that $5 million bond earlier this year. Those are taking place as we speak. So like I said, the two registers and the other are, all combined. So we just need the one vote on those.
Okay. All right, is there a motion for approval?
I have a question.
Yep, go ahead.
Dave, on the claims, have we seen an uptick in claims for COVID visits, or is it?
No, and I mean, knock on wood, we met with Frank, and I think Frank's on this call actually for the other item, but we have not seen we're doing very well in our self-insurance fund again this year, and not many claims at all for COVID related items. So, I mean, hopefully we remain that way. Certainly that would be encouraging. I think we're, at least in our area, I think, just tooting our own horn, the procedures we put into place for safety and, of the employees and all, whether it was early on the mask wearing and the distancing and keeping apart, I think that all plays a part in our staff healthy, and they're pretty good at adhering to that. So keep our fingers crossed on it.
Cool. Maybe I'll have a question maybe later for Frank. I was just wondering how, I know on the commercial side, insurance is not really sure how they want to respond to COVID in some instances. And I was wondering how insurance was doing for us on the health side as far as responding to COVID claims, COVID testing, for those that can't get free tests. I just curious about that. So Frank, while you're listening, if you'll sum up that answer for me, that'll be a question later. Thank you.
All right, are there other questions for Dave regarding the claims? If not, I'll take a motion for approval.
So moved.
Second.
Okay, motion by Sharon, second by Ben. Any further discussion? All right, Sharon, please
All right,
proceed.
Jim?
Aye. I'm sorry.
Gloria?
Aye.
Ben?
Aye.
Paul?
Aye.
Kent?
Aye.
And I for Sharon. 601.
All right, thank you. All right, approval of 2021 compensations and benefits.
All right, hello all.
Aye.
So hopefully you've had an opportunity to read through the memo. So this information came from the Finance and Personnel Committee and what we kind of discussed with everybody there. So the three main points are the employee pay increase, which we typically do at the end of the year. And so this would be effective December 20th, which would be the first pay period of the new year. And that pay rate is 3% increase for anybody hired before September 1st. And then all employees, of course, would be at the minimum of their pay grade. So that's the first point there. The second one, those who would be over the maximum of their pay grade or would reach that with the 3% increase, they would stay at the top of the range. And then there would be a lump sum bonus payment for that annualized amount on that same paycheck that the increase would go through. And this is the same thing we did last year. Number three, we had that compensation and classification study. And so we had split the changes up between 3 years. So last year was the first year. This would be the second year. So effective January 31st, we're suggesting putting that second year pay structure into place. And then anybody who would be below the new minimum of that pay range would move to the minimum. And then everybody else who is within that range would just maintain their current rate of pay. And then everything else as far as the health insurance, dental, vision, we have proposed that those all stay the same this year. I think a little bit later we'll talk about what we're thinking about for next year and that there might be changes based on the information and the research that we do. Any questions?
I appreciate the follow-up to Paul's question the last time about insurance, and I read in the packet. So thank you for that.
Yeah, it'll be interesting as we explore that, what that looks like, and really the importance of education of staff if we are to make any kind of changes like that.
Mm-hmm.
Kendra, and you may not be able to answer this off the top of your head, but is it safe to assume that there's been a 3% increase for, say, the past 5 years every year? I mean, how far back?
Yeah, I would say the last 4 or 5 years, there's been a 3% increase. Dave, if you remember anything different, but I feel like it's been 3% for several years.
Yeah, at least 4 to 5, like you say. I know we had gone down to, I think, a 2.3 at one point, but it's been 3% for the last 4 years.
It seems like it's been a while based on time I've been on here. And I'll preface this question by saying I don't view the city or the county as guides when it comes to this type of thing. But what did they do this year? What did the city and the county do? No offense, Sharon.
Yes. The city I have at 3% and the county at about 3.8%. And I think there's some union things in there that adjust that. And Dave, if you've heard otherwise, this was earlier on the information I'd received.
That's exactly what I'd heard. The non-union city were going 3%, I believe. And same with the counties. It was averaging out at 3.8, but that was due to some of the union contracts.
Has there ever been a comparison of the benefits as not just the salary? I know we always talk about, okay, what did the city do? What did the county do in terms of salary increases or not? But has there ever been a comparison of the benefits by anybody out there? Sharon, are you aware of anything like that, comparing, the benefit structures for the city and the county and other governmental agencies? I'm not aware of one, but.
Back when I first came on to county council, 2015, 16, we had a Weiss study, whatever the proper name for it is, that compared not only payroll, but compared as a county, what we were offering, and they incorporated some of those. And it was pretty level across the board when it came to the benefit packages. Where there was a vast difference was what was the county paying as opposed to some of the other government entities. And we found that the county was fairly below market. And we had to determine whether we wanted to be at market or above. But that was all in reference to county positioning. But the benefit package overall was pretty level across the board back 4 years ago.
Gotcha. Well, I had intended, and you can get that information online. It's easy to do an online search and see what the benefit package is for the city and the county. I intended to do that prior to this, but wasn't able to do so. But I will, just to share it with everybody, because I honestly don't know where we're at. All I know is, and I'm not saying this in a negative way, but the benefits for our employees are as generous as you can see in this market. And again, not trying to say that in a negative way. It is what it is. And it's a good thing for the employees, obviously. But hopefully the employees.
Now,
understand
Paul,
that.
are you referencing some of your concern or thoughts with government entities or with private sector versus public sector? Which way are you thinking?
Well, specifically what we're talking about now, or what I'm talking about, is how we compare with the city and the county and other government entities. If you were to compare us to the private sector, you'd see a huge differential in the benefits, because these are so much better than most of what you see out there. And so I hope everybody appreciates that and understands that. So anyway, that was really my curiosity and question. I do think we have a fiduciary responsibility to the taxpayers, though, too. You know, it's almost a matter of routine, these 3% increases. And so I just hope everybody's given a lot of thought to it.
All right, are there other questions for Kendra regarding compensation or benefits?
No, I don't have a thought, but I would like to add to what Paul was saying, and maybe it's something for him to, or us all to think about. I know on the city side, we did give a 3% increase, and on the county, they gave almost 4, just shy of 4, but they kept the calculation that they did last year for the 27 pay in with their current, which made it that weird number, right? The 3.8%. But I think a lot of them are thinking strongly, Paul, for the next year, because some of our thought processes we'll move forward with the 3 this year, because next year we may not be able to realize a change in that. And that's kind of where we thought from the city side moving forward as far as the 3% standard go.
Well, and I understand that. That's a perspective for sure. The other perspective is that this is a cumulative thing when you do these raises. So let's hope we do have the money next year, because otherwise we got to look at other areas. But you're right. We certainly have it within the budget now.
All right, any other discussion or questions? All right, I'll take a motion for approval of the 2021 compensation and benefits.
So second.
Okay, I missed you the first one. I heard Ben is second. Who was first?
Jim.
Jim. All right, thank you, Jim. All right, any further discussion? All right, please move forward, Sharon, with the vote.
Jim.
Aye.
Ben.
Aye.
Gloria.
Aye.
Paul.
Aye.
Kent.
Aye.
Marty.
Aye.
Sharon would be number 7. Aye.
All right, motion carries. Thank you.
That's
All right.
really weird to say Sharon would be number 7.
Sharon, you could count yourself number 1 and then start
Yeah.
with the rest of us.
Right. Thanks,
All right.
Ben.
Let's move on to the next item, which is resolution number 2020-8, the resolution to approve a pay structure for 2021. Kendra?
Yes, so we do this every year. And then again, this is the second year of the Pontifex pay structure change. So this reflects what the grades, the minimums and the maximums for each of those grades. Again, it'd be effective January 31st. This is when we'd move everybody into their new range. Those who need to move to the minimum would be moved to the minimum. Everybody else would remain the same.
Okay. Are there questions for Kendra on that? I know this is pretty cut and dry since we really approved the whole 3-year increase last year, but I want to make sure that everybody understands where we're at with this.
Kendra, will you just clarify those who need to move to the minimum is if they fall outside of the bracket when it changes, then they're moved up automatically? Is that what happens?
So when we move to this structure, if they're outside of the maximum, and maybe, I'm not sure if that's your question, they
Or
would,
the minimum. Which one, Sharon?
The minimum.
Okay, so yeah, so most of these minimums are moving up. So new hires, let's say, might be at the minimum of the current structure. So we would move them to this new minimum.
Thank you.
You're welcome.
All right, any other questions for Kendra? If not, I'll take a motion for approval.
So moved.
Second,
A motion by Paul, second by Sharon. Any further discussion? All right, Sharon, please proceed with the vote.
Sharon, aye. Paul,
Aye.
Marty,
Aye.
Kent,
Aye.
Ben,
Aye, aye, aye.
Gloria,
Aye.
Jim.
Aye.
All right, 7-0.
Thank you.
All right, thank you, Sharon. All right, now we'll go on to the approval of the Board of Library Trustee bylaws. I know that Ben and Gloria graciously agreed to work with Denise to have the fun and exciting task of updating the bylaws for things. So I don't know who wants to give that report on that. Denise, do you want to take it from there, or Gloria or Ben?
Can I ask a quick question?
Yeah.
We never discussed Kendra's, the other part of her presentation, which I think is why Frank is on the Zoom here. Or did I fall asleep? The memorandum dated November 19th about the narrow network review.
We can talk about that.
Yeah.
I mean, I assume we are going to. Isn't that why Frank is on the Zoom?
Yes, thank you, Frank. So
Go ahead,
from
Ben.
the Finance and Personnel Committee, it was recommended that we research possible cost savings for a health plan, specifically looking at the idea of a narrow network. And so what that would mean, of the two hospital systems, if one would provide a greater discount, which would obviously provide savings to the library and to those employees who elected that narrow network plan. So we, Frank, not we, Frank, looked into that, and one of the health systems could provide a greater discount. Potential claim savings are listed on that memo. The problem is we're not sure, obviously, who would elect that plan. So we're kind of guessing this is what it would look like if 10% elected that plan and on up. And so we really feel like we need to do a deeper dive into our current plans, as well as bidding this out fully. And also, like I had mentioned earlier, the education of the staff, so that they completely understand what this plan is, what it provides, any restrictions, and so that they're fully understanding what that option is. We also did an actuary review to determine COBRA rates, and there has been a large increase. So looking at all of that, we just felt like we really need to dive into that next year, be able to educate staff, determine what those rates would be, to institute this other plan of a narrow network. We need to understand what that looks like and what those rates would be. So what we had proposed is just doing that full plan evaluation next year in time to educate staff, decide what the best options are, and to present that information to you.
No,
The-
go ahead.
Did you not do a full evaluation? I thought that was what we just went through, that Frank did. So are you talking about redoing it, or?
I think she's talking about an evaluation for the full deployment of an additional network, and making sure that the staff or all the employees understand that. That would probably end up increasing the election of that if it were aligned with the right incentive and premium cost structure to make that work. As you can see by the study, indeed, the result was savings. And we then looked at it. Am I getting, are you guys getting feedback from my,
Mhm. A little.
I'm sorry, try something here. We looked at it in terms of percentage of participation, and obviously we don't know how many people would participate or shift to that type of plan. And the second part of that equation would be, would indeed those people that shift have the same level of claims that they had for the present period or for the basis of the study. But assuming that 10% would shift, there's certainly a savings level nearing 65,000. If it went up to 50%, we could almost see a $300,000 impact to lower claims with that electing group. So indeed there is, and this is the result of the study was, this is the lowest offer or the best offer that came from the two hospital systems. It was a good offer and significantly better than the other system who was asked to participate. The deployment after the library studies and decides the communication path and how they would implement it and what incentives they would provide to enrollment for that type of plan would be designed and worked into a separate plan that would be offered through and Proclaim would administer that plan. If I can take a moment to Sharon's question, we don't have a measurable impact from COVID to the library yet. We've asked for an impact study. We do not have it, but I think of significant metrics. The October result, we don't have November in yet, but we are currently 15% below plan costs of the prior year. And it seems to be trending in that direction. So everything is moving favorably with the nature of the health plan. Questions that you may have at this point?
Just to kind of dovetail off of what you just said, you know, the big concern, if you, and I'm on an awful lot of calls, like with the State Department of Health that the hospital has and all that, you know, the big concern and the reason, the primary reason most people seem to think that claims are down is because people are obviously not having services performed that they normally would.
Right.
So given the lag, it's kind of like the reverse of a preventative health program like we have. We're probably, and I'm saying this generally, but we're probably going to see a increase in claims after the pandemic because people will then start getting their cancer screenings. I mean, colorectal cancer screenings are down 90%. So you're going to see, not just with that, but in other parts of the body, for lack of a better way of putting it, we're going to find all sorts of things when we're able to start doing those, you know, elective tests. And so claims will go up, there's no doubt. With regards to the narrow network, I want to be really, really clear because I think it's easy to get confused about this. You know, I suggest it because I see it in the industry. That's what I do. I was not involved in the bid or anything along that line, but I know that this is something that is occurring at employers. And some of those employers I've noticed have been, they say, well, we don't want to restrict our employees from using either of the healthcare systems. We're very lucky in this market to have two strong competitors. It's good for everybody. There's no doubt about that. I would not want to see it any other way. But this concept does not restrict anybody from going to whoever they want to. What it does is it allows those employees that want to save a few dollars. And frankly, some of the differentials that we're seeing with other employers, it's $30 a pay period reduction out of their pocket, out of their paycheck to take this narrow network option voluntarily. And so then you got $60 a month. For some people, that's a considerable amount of money. And again, it's completely voluntary. You continue to offer the open access network at a higher, you got to pay for it, but that is a big trend. And so the reason I bring this up again during our conversation today is I don't want us to just forget about this. Things have a tendency, or had a tendency, I should say, to kind of slip through the cracks. I think timing wise, it's unfortunate. I wish I could have brought this up, months ago. But clearly, it doesn't make sense to do this right now. I understand that you got to have the employee education and all that. That makes perfect sense. But let's not forget this, because it is an opportunity. And as Frank will attest, I'm sure these are just projections. It could be less savings. It could be more. But what I believe is that over time, it will actually increase. You'll find more and more people that will be interested in that type of an option. So that's all I wanted to say. I'll shut up.
Paul, if I may comment, and I appreciate you letting me help here. To your point, I think with the way that the library does things, they thoroughly vet it and then make sure that the employees understand it. I think you'll have a greater participation in a additional offering like this than you would have otherwise, or in other organizations that don't do nearly as good a job in preparing the employees. With your earlier comment about the hospital claims, that's certainly what we're seeing. The elective surgeries have gone almost flat during this pandemic period. And we expect those elective surgeries to spike as the pandemic, approaches the end of the cycle, and we do have a vaccine out there, that those things will come back into play. So indeed, I think we will see an increase in claims next year. But with the trending right now, without going line by line with the cause of the claim, we are seeing, certainly a 15% reduction in the volume of claims that we had in the prior year. So that's good. We're not sure what November and December is going to bring, but it looks like it's trending in the right direction, at least through the end of the year.
Well, greatly appreciate you all doing the analysis. And timing's unfortunate, but it is what it is.
With that new option, has there been any research done by the participants in that option from other entities? What are their thoughts about it, and what are the age ranges of the individuals who hop into that? Is there a differential in that?
Well, I'll give you, I assume that was direct. Are you asking me?
Yes.
Okay. I'll give you one example that I'm aware of. General Motors, which has a lot of employees out there, offered a similar concept, different payer, but similar concept last year to some of their executives. It's only like 30 people, I believe. I believe they're going to open it up this year to all of their employees, and they expect it to be a significant number of the some 4,500 employees that will move into it. Because again, it's an instantaneous way to increase your take-home pay.
Is there something that I've heard that you have to have so much in an account that people want to have, so they draw from that because they'll not go above that amount?
I think you're referring to a health savings account, which I'm not nearly as knowledgeable.
Okay. Is that?
Yeah, Frank could answer that better than I. But the two are completely separate, I believe.
Okay.
I think the trend, right? I'm sorry.
Well, we don't have that. We don't have the savings account for.
We do. It's for those staff who take the high deductible plan. Currently, it's linked, HSA is linked to the high deductible plan.
All right.
Narrow network is yet another plan.
Okay.
But overall, I think where we've seen this type of model go into employers, you first have the election. Well, I'm already using X hospital system, so I might as well go to the narrower network or to specifically that hospital system with the plan. Then with greater education, people evaluate, well, gee, my claims are going to be potentially lower if I go into that system. And then you match it with an incentive, either a premium incentive or some offset to elect that type of plan, which is going to be a lower cost to the employee. Then you would have more participation. It certainly makes sense as long as everyone understands it and the movement into a more narrow plan with one hospital system.
Well, thanks again for
Excuse me, I just have one question. I know we're studying it and we're not going to vote on it now, but just out of curiosity, in the narrow network, if there's a specialty that the network doesn't have, is the referral out of network costed out the same as if it would be in network?
Typically, no, no, it would not be. That's the whole point of it.
That's the whole point of steering, to stay within the network.
That's the quid pro quo, basically.
Even if that specialty didn't exist within the narrow network?
Well, that depends on how you structure. And again, Frank knows more about this than I do.
Yeah,
But
there are many arguments
Yeah.
where that specialty doesn't exist, and usually that would involve the medical board to determine whether that would be an event that would cause a differential of the plan. And that's usually, there are very few circumstances like that in Fort Wayne because we generally have most every specialty represented in both of the hospital networks. So it's a rare occasion that we have it. But if we do, that becomes a point of discussion to see whether that can be a covered event. But typically, if they elect to go out, just because they prefer that specialty outside, if they've elected the single hospital system and they elect to go outside of that specialty to another specialty with another hospital system, that would be an out-of-network event and would be a higher cost.
Okay, thanks.
All right, any questions, any other questions for Frank while we have him with us today? I appreciate all of you who know way more about all of this than me to study it and look at it. So thank you for that. Although I do follow it pretty well, it's just always nice to have good brains in the room to work on that. So I guess to Paul's point, we look forward to next year, understanding that a little better, and then hopefully working through that to be able to give some savings to our employees that want to go that route. So great.
Thank you. Sounds good.
All right, so now I'm gonna, I believe, move on to the bylaws review and that, and I'll throw it to Gloria, Ben, and Denise.
Okay, so when I was appointed interim, I started looking at things that had to get done this year, and the bylaws review had to get done. So I read the code and noticed that we have one place where our bylaws could have been improved, and that was to add the term of your appointments. That was what was missing from our bylaws. So the recommendation is to add a section 4, which is term of appointment, and just specify that it's 4 years. And your appointing authority, they've all been, when I looked at it historically, all the appointing authorities used a 4-year term, except at the very beginning when you were staggered. But now you're many years into this, so the staggering is no longer relevant. So the recommendation is to add a section in section 4, term of appointment, and then adjust the other section numbers with the introduction of the new section, and to adjust the approval date for review, which is today. So those are the changes.
All right, and for those not aware, our terms are 4 years. So that's what was added into there, that the term of the appointment shall be 4 years. All right, is there a motion for approval?
So moved.
Second.
Motion by Marty, second by Sharon.
Yes.
Any further discussion? All those, well, I'll back up. Sharon, please proceed with the vote.
Jim,
Yes.
Gloria,
Aye.
Ben,
Aye.
Paul,
Aye.
Kent,
Aye.
Marty,
Yes.
I for Sharon.
All right, motion carries. Moving on to the appointment of Board of Trustees Nominating Committee. So as noted in the packet with the memo, every year we have an opportunity to put a nominating committee together to work on officers for the next year. And it's that time of year. Are there any board members who are willing to serve on that nominating committee?
Is it supposed
I
to
will
be?
volunteer.
Okay. I like that.
I can appoint, of course, from that standpoint. I guess it really is more of an appointment. The bylaws allow me to appoint that, but I always want to bring it back to ask if have a volunteer first.
Is it supposed to be officer, or are officers supposed to serve on that, or does it matter? I can't recall.
I don't think it specifies.
I don't think
It doesn't matter.
It doesn't matter. Okay.
And if Sharon's going to be on it, I want to be with her.
All right, so Sharon and Ben.
I'll volunteer to do it. It's fine.
All right, and Marty. Excellent. Are there any others? Well, we can't. That'll be a quorum.
That's
So, that's it. The three of you. Thank you very much for your help on that, and you are so appointed
it.
with the authority vested in me, I guess. So.
And Sharon's in charge to call the meeting. I'm calling it right now.
I second that.
There you go. So Sharon's got the busy schedule too, so that works. All right, thank you all for helping with that. All right, next is approval of the amended code of conduct. Oh, I'm sorry. Number 10, a reappointment of the Library Building Corporation Board. If you'll remember, this came before us several months ago, and this is related to our bonding and things along those lines. And Dave, do you want to, Dave or Pete, either one, do you want to talk about it a little further just to make sure we clarify what this is again before we do this reappointment?
Right. I mean, either one of us can. Again, the building corporation, as you said, Kent, is the financing arm of the library. They're used when we have to do first mortgage bonds. And the four members that are listed there, there's a fifth one that seat still needs to be filled and have an appointment to it. Really, we only meet once a year unless bonds are issued. And then we will meet to have the various signings and things like that. So it's not a time consuming, but it's necessary, to happen.
Okay. And I know that, in 2022 or next year, we're working on capital plans, and in 2022, we're likely to have bonds that are going to be moving forward. So this committee will be maybe a little more active in the coming years than maybe they've been. So on that front, standing in front of us right now, members of the committee currently are, or members of that board, I'm sorry, it's again the board of directors for the Allen County Public Library Building Corporation. The current board members are Michael Horton, Alan Grinsfelder, Janice Coday, and Richard Beck. The four of them stand, and then a seat was occupied by Miss Betty Stein. Of course, she has passed on, and so from that standpoint, we will have a vacancy that we will work to fill, but to be timely with our reappointment, we wanted to bring this forward this month to at least reappoint the other four members for a consideration to the board. Are there any other questions at this time? If not, I'd take a motion for approval, please.
So
This is
moved.
Marty, so moved.
Okay, I'll take a motion by Gloria.
Second.
Marty as a second. All right, any other questions, clarifications? All right, Sharon, proceed with vote.
All right, Kent,
Aye.
Marty,
Aye.
Paul,
Aye.
Ben,
Aye.
Gloria,
Aye.
Jim,
Aye.
I for Sharon.
Excellent. Motion carries. Thank you to those people who continue to serve on that committee. We appreciate your time, and just one more way that people can get involved with the library. And I just would ask any board members right now, if you have any other thoughts to fill that vacancy, if you could just either email Denise or myself with those, and then we can make the appropriate steps to get that on the agenda here in the future. All right, moving on to the approval of the amended code of conduct.
Okay, so as you'll recall, a request came through the board for a recommendation to add to the code of conduct a mask requirement. We senior staff, took that recommendation and went back to management and had dialogue with them. A small group was put together to look at various facets of the organization and get feedback. Their recommendations were taken to management team on November 3rd, and we have over 40 managers who participate in that meeting. There was much conversation back and forth about it, and it was determined that primarily the branches are doing just fine in managing the public wearing a mask properly and consistently while they're in the building. We had issues at the main library in some departments. So the recommendation from staff was actually not to be specific in the language, but rather to broaden the language to give us something that's evergreen and really more durable over time. So you have in front of you a marked, a red line version of the code of conduct and a clean version of that. And what we're recommending, and this comes from staff, from management, if the federal, state, or county or local, if the federal, state, county, or local government declares a state of emergency, library users must follow recommendations and requirements declared in the order, as well as comply with staff directives when using library services. So that's our recommended additional text. So I'll be happy to take any questions, and we have other managers, senior staff who can provide additional clarification if it's needed. So.
And I know one of the concerns for this as it came to us was staff maybe feeling like if it's a part of the policy, then there's they're allowed to be able to have maybe more teeth to be able to work with the patron on why it's important and what that means if they aren't following the rules. It's my understanding that the consequences for not following will be laid out in the procedures, more of your operating procedures, correct on that?
Correct.
Okay. And you're working with management to clarify those or add some depth to that as well?
Right.
Okay, great. I just wanted to make sure that we all understood as a board that, you know, our job obviously stays in the policy. I think that this does do a good job of allowing then for you to be able to respond to that in procedures and operation policies too. So.
Mm-hmm. And pull back when it's not necessary, right? That's the other thing.
Yes. Are there other questions for Denise on this?
This is Marty. I just wanted to give you a compliment. I thought the language works really well. You know, I'm kind of interested in seeing what the procedure looks like eventually, or when you have that completed. But I like the policy language. I like the way it can cover other issues that may come up in the future as well. So I think this makes a lot of sense.
Thank you.
All right. I will take a motion for approval, please.
So moved.
Second.
Motion by Marty, second by Ben. Are there any further questions or discussion? All right, Sharon, please proceed with the vote.
Ben,
Aye.
Marty,
Yes.
Jim,
Aye.
Gloria,
Aye.
Paul,
Aye.
Kent,
Aye.
Sharon, aye.
All right, thank you. Motion carries. All right, moving on to committee reports. Ben, an update for us on the Director Search Committee.
Yes, as you know, a number of groups were surveyed, asked by Bradbury Miller, the search firm that we engaged, to help form the profile for our next executive director. As a consequence or as a result of that, the Bradbury Miller consultants posted on their website the job description, quite lengthy, and it's still up. They're keeping it up until the end of this month. It generated significant interest. As of Sunday, when I spoke with them, there were 17 strong candidates. In addition to that, they are not taking a passive role. They're also knocking on doors and soliciting indications of interest based on background of individuals that they're familiar with. The door will close by the end of this month. Then the committee will be reassembled. The individuals that have been suggested for the first pass will be presented. That group will be winnowed down, all this done virtually, to probably 7 or 8. Those individuals then will be presented to the board to winnow down to 3 or 4. And then they will be invited to participate in a virtual interview process. And basically that's where we are at this point. It appears, with the COVID situation being what it is, face-to-face interviews, at least over the short term, are highly improbable. That's the report. Kent, you're muted, Kent.
I knew what I was saying. All right, thank you for that, guys, and for your update. We appreciate your time on that committee. We can move on then, I believe, to the Roland Center for Lincoln Research update. I had stated that it's been a while since we maybe heard about where this project is at, and so I asked Denise if she could have Kurt come and give us an update on the project and fill us in on that portion of it. So Kurt, I'll hand it over to you.
Thank you very much. I really do appreciate everyone's time to spend a few moments with the Roland Center for Lincoln Research. In a year that's been really uncertain and topsy-turvy, it's been a pleasure to work on this project, and I'm happy to report to the trustees that the project is on target 100%, which is really amazing in this year. Thanks to our selection of a great architectural firm and the team in special collections, the team in CME, leadership through Denise. We just continue to move forward. I provided you with a lot of renderings so that you can ask questions if you had a chance to look at those, but just wanted to tick through some highlights. So we spent a lot of the year in necessary planning. So we're really after an opportunity to make more of the artifacts in the collection available for our community to appreciate, to see, to look at, and to engage with. At the same time, on a parallel track, we're interested in creating digital assets that will engage even further, that people can take a picture and on their smart device, enlarge it, download it, see other pieces of the collection that relate to that in a digital format. At a third parallel level, we're looking at having apps developed that would actually allow us to push this Roland Center into classrooms throughout the entire county. Things are just going along really well. As you might guess with any project, particularly one that's both bricks and mortar and technology, there's a lot of discussion and a lot of planning. Sometimes we're up to 4 meetings a week, but things are moving forward just really well. We had Pete help us with reviewing the bid specs. We did advertise for bids on the 6th. We had a second advertisement on the 13th of November. We had I thought, a wonderful pre-bid walkthrough on Monday. Why I declare it wonderful is there was a lot of interest. There were a lot of contractors there. So it's not like there's no interest in this project at all. Design Collaborative offered, and I believe that they're correct that there are a number of contractors the library has worked with before and have played well in the community. Like these winter projects, kind of bridges them from a heavy construction season into the next construction season. So great interest. A lot of people asked some good questions on the walkthrough. The bids will be due at 1 o'clock on Friday, December 4th, I believe. It's in your document. And we will open them Friday, December 4th at 1:15. We'll be getting our ducks in a row as far as opening those bids in the proper form. And then we'll move fairly quickly into negotiating with the successful bidder for a contract. Again, things are just going along very, very smoothly. I'm so pleased with the renderings and the work that you can see in front of you. The pictures don't really tell the whole story, but the pictures are worth 1,000 words. So with each picture, you get 1,000 words worth of Roland Center activity. We have continued to stay in touch with our initial keystone donor, the Roland Family Foundation. I can report that they are quite pleased with the progress on the center, which is going to be named in honor of Ian Roland. The Friends of the Lincoln Collection remain very much involved and very committed to raising the funds for this. We have had a couple of meetings devoted to development. They're kind of taking the lead on that, but Stephanie and her expertise have been guiding those activities and working really nicely hand in glove with a really dedicated group of community members who also want to see the Roland Center succeed. So I'm appreciating and respecting your time. Are there questions or further clarifications you would like to ask or like to have relative to the Roland Center?
I would just like to say thank you for the document. It's really nice to be able to read, some of these details and the timeline and the pictures and all that. It's really exciting. So greatly appreciate it.
Thank you, Paul. It is exciting. Thank you.
Yeah.
Denise, did you have a comment?
Yeah, could you clarify, the bid opening is going to be done virtually, right? We're Zooming that?
That's my understanding, but I think we want to clarify that as we walk toward that date. Yeah.
Okay.
Yeah.
Thank you.
Yeah, we want to be responsive to current community health needs. Absolutely.
I had a question as it related to the layout just a little bit. I know when we first had been briefed on this a little bit, we talked about where it was going to kind of be located. I don't know if James can turn on permission for screen sharing or not, but I thought I would pull it up and ask the question. But if not, then I can. I guess I knew that we had originally talked as we come in the east doors. We have the 3 bays there.
Correct.
And I can interpret, I believe, from the drawings that this will be located in the 2nd and 3rd bay.
You are correct. Yeah.
And in the 1st bay, we had kind of talked, I know the whole point of leaving that 1st bay either intact or whatever was to make sure that we kept the windows along the side and we just kept as much natural light coming in as we could. Is there anything in this right now that also modifies that 1st bay that creates a hallway or anything back to collection back there, or is the 1st bay there going to be something different?
Great question, Kent. And I think I'm partially qualified to answer that question. My colleague, Kim Boland, is probably a little better qualified with Denise. We moved it to the 2nd and 3rd bay just because it worked out better and for the exact reason you articulated, to keep natural light in, et cetera. The capital plan that's being developed right now will be addressing potentially that 1st bay and opening that up or not, or creating something. So it's really not part of the Roland Center project, but it is a part of the larger facility project that Denise and Kim are taking the lead on. So technically, no, it's not part of Roland, but it's part of the larger facility plan that's being put together.
Okay, great. And that makes sense. I mean, if you have anything more, Kim or Denise, that you want to add to that, but that I know we'll probably hear more about that when we start seeing plans for changes at Maine and things along those lines that are more of a comprehensive nature. Okay, perfect. Thank you on that.
Thank you. Denise?
Sorry, can't unmute myself. So one of the things that is happening as an add-on project during the Roland work is there's new lighting that's going in, and we're making sure the Great Hall has consistent lighting, ceiling fixtures. So the library is using capital to pay for that additional work. So when it's all done, the Great Hall has consistent lighting. The work in the first bay on the plaza side is to be determined. And we have some plans. We just need to decide what we can afford to do.
Yeah. And if I could just piggyback on Denise's comment, and again, it's a positive thing in a year that really hasn't had a lot of positivity to it, but changing out those lights, great savings in time and effort for Jake and the maintenance crew. The lights that were installed in 2006, 2007, really beyond their life. And these new lights, LED lights in the Great Hall, significant cost savings. So cost savings in labor and time to change the bulbs, but with LED, the frequency of change will be years, not weeks and months, and electricity for those really shrinks dramatically. So it's a nice hand in glove project.
Okay.
I have a quick question if I could. I know you can't mitigate all risk, obviously, but have we adjusted or are we adjusting the RFP process at all based on the history, the lengthy multi-year history of the lawsuit that we had with the original construction? So does that make any sense? I mean,
it makes great sense to me, Paul.
Okay.
I'm going to be very careful about my response and say that this is a public bidding process. It's not an RFP for the construction. It will be public bidding. So by law, the library, as any owner would be in the state of Indiana, is obligated to accept the lowest responsible and responsive bid.
Responsible and responsive. You did say that, right?
Yes,
Yeah.
responsible and responsive.
We dealt with that language on the city council, and responsive and responsible, not necessarily the lowest. That's what you're saying, Paul, or Pete.
It's both responsible and responsive, if I heard you right, Ben. Is that what you're asking?
Yeah.
Yeah. And they mean different under the law.
Okay. Appreciate that.
All right. I know another thing related to this center is that we will be having an MOU that comes before the board as well that will have a conversation and just solidify and ink the operating costs moving forward and things and how those are shared between Friends of Lincoln and the library and what that looks like, just to make sure that it protects both parties at that point, just to make sure we're all agreeing to how this looks as we move forward after it's actually open and built. So look for that to come in the future months here.
Excellent point, Kent. And we've had internal discussions, and Pete is assisting us with that right now. Yeah.
Great. All right. Any other questions for Kurt? Well, thank you, Kurt. Keep up the great work.
Thank you so much.
Exciting. All right. Let's move on to the report of the interim director, Denise.
Okay, so in the interest of time, I'm going to just refer you back to the packet that you have for me, which includes my update, the manager's update. I want to let you know that I had instructed managers based on Ben's recommendation to, call out some highlights that we've asked managers to pull out, 2 topics that they want to highlight each month. And we're hoping in December we'll be able to get the webpage set up and a place to park these. So we'll be working on that. I'm working with Stephanie, and we'll be working with IT to make that happen. But you can expect to see that in December, hopefully. You have the collection manager report from Nate. You have the third quarter 2020 strategic plan update which follows the newer format that I had. In that, I just want to call out, we were able to get some really good data from Visit Fort Wayne about their website traffic and how much was pushed to the Genealogy Center. So took us a while to get that. We thank them very much for that information, and to Stephanie's team for working with them to get that. And I was glad that we were able to report that to you. And you also have the regular monthly output reports. So that's, if you have any questions, just let me know. But what I'd like to focus on is now that we're in code red with the county, I had sent to you earlier today our working draft of our plan for adjusting services around the need for having fewer people in the building, but still providing high quality service. So what we're hoping, many libraries have literally metered the number of people in their buildings. We don't want to move to that. What we'd like to do is, by limiting some of the services that we have to by appointment only, that we'll be able to manage customers in and out of the buildings, and keeping the public safe, keeping our staff safe. So what I sent earlier today lists a couple of things that are in alignment with the Department of Health and the executive order from the governor, and that is a face mask or covering mandate. We had that in place earlier, but what this will do is allow us to eliminate, we had a medical waiver that we were allowing the public to use, and we will take that away. It was in response to, as you heard earlier, from staff concern about being able to ensure that the public wears them properly. This will make it a little bit easier for staff. So if there's a medical condition, we're sorry, but you can't come in the buildings. It's just, it's not fair to staff, and it's not fair to other customers who might be in the building. Food and drink, we're taking that away because the mask, they're saying wear it indoors, wear it outdoors. No food or drink in our public areas with customers. Staff, of course, can bring their lunch and whatnot, but this is for the public. And social distancing, we've been doing that anyway. We had limited the number of computers we had distanced tables and chairs. That will still remain in place. We are going to adjust our hours slightly in all locations to accommodate both higher staffing levels to support more curbside, increasing our curbside service, and also handling more transactional work with the public who would come in and use public computers. So we're looking at by appointment for public computers, and also by appointment for use of the Genealogy Center, which is a big draw for us. So we wanted to be able to accommodate those customers as well. So Kurt is working on a procedure for that, so that our staff at Maine, primarily our security staff, will be able to, at the Ewing Street side, because that will be the only door we have open. The plaza side will be closed, so we'll have security at the Ewing Street side. And those guards will be able to work with the genealogy staff, as well as the understanding PC reservation, to let customers in who have appointments and then get them to the department that they need to be in. The PC reservation will be primarily in readers and BST. BST doesn't currently have any computers, but they do have databases. PC reservation is at readers. The challenge with also opening this up for children and teens, and we're still talking through this, is that those spaces are limited to specific age customers. So we have to talk through that a little bit more, but that's where we are with that. We're going to increase the holds limit by 100%. So we're going from 10 holds to 20. We think staff can manage that additional load with curbside. So checking out more materials per customer and delivering that to the curb, we still think that's okay. We have custom collections. Custom collections isn't used by many of our customers, but the ones who use it really love it. Right now, that program is designed that, a request comes in and I want books on ponies, or I need, an array of books for, I homeschool and I need an array of materials for my homeschooling. What we do now is the staff pull those materials, the bin's prepared, the customer comes in and looks at it and decides what they want to borrow. The difference will be staff will curate that collection for the public. They'll work a little more closely with the customer. and try and get it as tight as possible. But the entire everything in that bin is going to get checked out to curbside. So it's going to be placed on hold, and then the customer will get everything that's in there. And we're sorry, but you'll get stuff that maybe you don't really need. But that's the simplest way for us to manage that. We're also looking at other collections bundles of material that we'll be able to circulate. And this is a benefit of WISE, actually. So we're going to explore that a bit more to see if there are more things we can offer down the road. The library card applications, we'd moved to online earlier. We're going to continue with online library cards. Browsing won't be possible. We apologize, but staff can help you with holds placing, and you can do curbside pickup. Our outreach and homebound services, we'd seen some pullback. So early on, we kept homebound service going the whole time. The challenge was that the facilities that we were delivering to had restrictions. So there was this back and forth and some readjustment as we went through this. We will just continue to provide those services as those facilities are able to accept our services. And for homebound individuals, we will continue to deliver materials to their home, provided they're comfortable with us doing that and our staff are comfortable making those deliveries. Our meeting rooms, we're going to not take any additional bookings for meeting rooms, and we will cancel meeting room bookings that are at Maine because that's where most of our bookings are, because our branch meeting rooms have been used for quarantining materials. So our event staff will handle that. We'll push them out if we can into February, but right now we're talking about canceling all meeting room bookings that we have through from November 27th forward to probably the end of January. Study rooms, currently they're available. We will not be making study rooms cannot be booked. And any bookings that we have will terminate those appointments. I talked about genealogy service. Reference service, we're just going to continue doing virtual and phone reference. So what's taken away is the in-person, but we'll be providing reference service at every location. So all staff will be working on that. E-resources, we had already ramped that up, as I said. And just an FYI, I got a report today, so I'm trying to find it. Got our Hoopla report. So Hoopla gives us, it's our one of our e-content providers. They do ebooks, e-audiobooks, and streaming film, television, and music. And they got us our report. So in terms of how quickly folks pivoted with the first closure, we are the #1 circulating library for Hoopla content in the state of Indiana. We are number 19 in circulation in the United States. And we have the 31st highest number of customers. So when you look at all the customers supported, we're number 31 in the country. So we have very loyal Hoopla users. So we are in December, we do a double download. Kim Quintrell is working with Dave to figure out where the money is going to come from, but we're going to do double download again in December. So they can download twice as much material. We also had an increase of almost 5,000 customers, Hoopla customers, in the last 12 months. So very high volume of use of that resource. So it's money well spent. Quarantine materials, we quarantine for 24 hours now. We'll continue to quarantine for 24 hours. Our book drops will stay open as long as we can have them open. I don't want to jinx this, but unless there's a complete stay-at-home order, there's no reason to close the book drops. So we will continue to manage those. Building maintenance will continue at all locations as it is now. Safety and security will remain the same because we'll need our security staff to help monitor the doors for the in-person by appointment service. And we're still working on the main parking lot. So the lots will remain open and the garage will remain available to customers using the building as long as we have 3 security staff. If our staffing levels drop below 3, we won't have enough security staff for the building, and we would close the underground garage, but the service lots would still be available. So that's where we are right now. There's still some moving parts, and I really raced through this, and I apologize. But for the most part, it's business as usual for us. All staff will report to work. What we're doing is trying to limit the number of people coming into the building just to keep everyone safe. And we're doing that by appointment, computer use. And while they're there, if they need to use a fax machine, a copy or whatever, that's fine. And by appointment, use of genealogy and curbside delivery of holds. So that's how we're trying to manage that traffic in and out of the building. So I threw a lot at you. I apologize. I'm happy to take any questions, and senior staff is all here and we can do the triage on this.
I did have a question. I was reading when this all began that some libraries were increasing the internet signal so that people that didn't have internet at home could be within the proximity of the building and utilize their laptops or their iPads. Is this something that, I know it's winter, but maybe with a car in the parking lot, someone might be able to access the internet that does not have internet service at home? Is this anything practical to look at and see if it might help our patrons?
Yes, and the signal already bleeds into most of our parking lots with the exception of Maine, because there's not a parking lot close to the building. But that is certainly something that IT has looked at before to just spread the signal a bit further. And Kim Quintrell is on the call. We had actually discussed earlier, we haven't implemented it yet, but was to put sort of painted symbols in parking spaces so that customers knew where the signal was strongest. And that's something that we continued to talk about doing. But yes, so it's possible, and we can increase the signal to some extent because we have routers, internet signal devices on our buildings. So we do that as best we can. I think in some locations you would have to add devices, signals, boxes to the buildings, but I leave that to Kim too, because I really muddled that up. But
so when we shut down before, we polled our staff, and like Denise said, the internet access is available in the parking lots of everywhere except for Maine. And Denise, you talked about we could put paint little symbols on there. But at this point, I don't see, unless we want to increase something at Maine, I didn't see a need to do anything else.
yeah, and what's different from when we closed before to now is we also have hotspots that customers can borrow, and they've been circulating like gangbusters. And we've already been talking about, do we need to increase the number of hotspots we have for the public to borrow? And Kurt, sorry, Kurt.
If I could just add one little levity to this. While we don't have close parking lots, because my office window, if I turn my head right, I can look out on Wayne Street forever, well before pre-COVID, 6 o'clock in the morning, 6:15, 7:30, 8 o'clock, 8:15, and at night, cars are parked along Wayne Street because Kim and her team have the signal bleeding out of the library north onto the sidewalk and onto all the parking meters along Wayne Street. So in essence, there is a parking lot for Wi-Fi.
That's good.
But we can, so then we can also see the traffic every day to understand like how much more capacity we need. So we can adjust that on a daily basis. So one other thing I wanted to point out, that we're recommending a time frame that seems a little late, but we're recommending starting this the Friday after Thanksgiving, because one of the things we had heard from the first closure was that the public didn't have enough time to pick up their holds or get materials that they wanted or use services. And we don't want that to happen again. We want to give folks plenty of time. So we're going to stay open as usual through Wednesday, closed for the holiday, and Friday when we come back, we won't be on restricted by appointment service. So that'll be the switch date. And we would like to run this, paying attention to what the mayor has done, and closing down Citizen Square through the 19th, using sort of loose science on that, and anticipating cases after the new year and just 14 days beyond that. We were thinking that we would take you to the board meeting in January, because then you could make a decision. If we had to extend it, that decision could be made at the January board meeting. And if we're lucky and we go back to orange, then we would just roll it back and reopen completely. I doubt that we'll be back in orange by the middle of January, but we could get lucky.
Do you have any statistics in terms of staff that have tested positive?
Kendra does.
I do. So we have dealt with over 130 different situations that could be or were COVID related. We've had 6 positive staff members, 58 who tested negative.
Well, that's pretty good. I've got 8. I have 8 in my office, and there's only 40 people in my office. So
Yeah.
that's pretty good. Which leads me, though, that's really good actually. But that leads me to my next question: is it feasible to, particular if you're gonna at the downtown facility, gonna kind of funnel people into one door? It sounds like, which makes perfect sense. Is it feasible to have somebody there that, you know, there's a very simple list of questions that you ask people, you take their temperature, or is that just too difficult to do? Is there any value to doing that, you think? Because what we have seen is, and of course we're doing that, it's like Fort Knox trying to get into a hospital these days. But what was seen early on, people would, you know, answer no to everything, but they would actually be running a little bit of a temp. And so my question is that something that we should consider, I guess?
Well, I can speak from a public services side. Kendra can certainly speak to the staffing side. So one of the reasons we didn't want to go down that path is that we have no consistent way of implementing that. So we don't have security at every building there. So we would have to train staff in doing that. And it was just, we couldn't manage that.
I was just thinking of the downtown just because of the volume at the downtown. I mean, that seems like the logical place to do something like that. So I wasn't really talking about some of the outlying places, and I understand what you're saying. It would be very difficult to do. So just to clarify.
We can certainly talk about it. I mean, the church I go to every Sunday, I fill out a form because they want close contact information in case they have to contact trace. So I
I'm not going, I wasn't going that direction, but I understand what you're saying. Everybody's doing it differently, and I'm not pushing for it necessarily. I'm kind of surprised I'm the one that brought it up, actually, because I'm not a big fan of the masks and all that stuff, but there's a variety of things you have to do, obviously, to keep everybody hopefully safe.
Yeah.
And it's not much of an expense to do something like that. I mean, granted, you got to have, you know, probably one FTE dedicated to that. But anyway.
We can look into that.
It's also been shown it's not always reliable.
Right.
So it's kind of a waste of time and money in some cases. I think the mask and the social distancing and sanitizing is your best bet. And you're not going to have as many people in the library.
Mm-hmm.
Well, I'm not suggesting this is a replacement to masking or anything along that line. I'm saying in addition to, just as a screening process.
Yeah.
So I, just my 2 cents. So I just think about, you know, we're putting staff, you know, it'd be more than one person in a little bit more harm's way because they're going to be closer to people, in connection with people more than maybe others would be, the PPE that needs to be provided, the training that needs to be provided. I get what you're saying, Paula, that just, those are my thoughts on instituting something like that.
Well, I can tell you where it is done. It's just, the person just wears a mask and a shield. That's not terribly expensive. But you know, you got to buy a thermometer and all that. Again, I'm not hearing an outcry for it, so I'm not worried about it. Just a thought.
So we'll leave that up to Denise and staff to figure out if you want to add. I mean, especially for the downtown branch, it's not a bad idea from that standpoint, knowing the volume you have there, to Paul's point. But I think we'll leave that to you guys to research and figure out if you want to do that. All right, are there other questions around these new procedures and parameters?
The only question I have is how are we going to get this out to the public as quickly as possible?
So Stephanie's
Email,
already
Facebook, what are we doing?
Stephanie's already written everything. And she was ready to adjust it based on this conversation. So our plan is to actually, after this meeting, Kendra is going to send out the open enrollment information to staff. So that will go today. Tomorrow morning, we will email all staff with this guidance of what's being changed and when. And then it will also go out through our social media channels. It'll go out on the phone app, and it will go out through the Circle e-news to 80,000 people. Stephanie will also be contacting the media so that they're aware of the changes. So I think, and the website, of course, we're going to update the COVID-19 FAQ. We've already been working on that, what the changes are from the original guidance. So I think we're ready to go.
Yeah, we will also have signage at all of the locations. We will also, because genealogy is now involved specifically, which is a little bit different than last time, we'll be working with Visit Fort Wayne to make sure that they're aware, they can update their communication channels. And then also Kurt and the genealogy staff have an extensive database of contacts for their Spaces users. So we'll be communicating on several different fronts.
Okay.
Is everyone okay with the time frame? You understand why it seems broad, but it just seemed to make the most sense to us to position it between board meetings. And then again, if we go back to Orange and we're there for 2 weeks and we can pull back, we will, and we'll just announce that whenever it happens. It just seems right now that, we don't know the end, right? So we're trying to plan for something where we don't know where it's going to end.
It's kind of fluid.
Yeah. I think you kind of just answered my question on that, because I look at this and go, we're merely hearing how you're responding tonight. We're obviously not approving it from that standpoint, because this is an operations decision. So I think you answered it. I mean, the current order goes through, I believe, December 12th with the Board of Health. And so if we would, somehow go back to Orange, then you're saying that you would pull back to the Orange levels then at that moment and respond immediately and communicate that maybe a few more services are open and whatever we're opening at that level. So
that's okay. Right. Yeah. And that would happen. So in the document I sent you, the first column or the middle column is the, code orange through blue or blue through orange. And the column on the right is when we go red. This is what gets pulled back. So we'll just go back to business as usual at as many locations as we can. The other reality of this is at any time we may not have enough staffing, and we may have rolling closures to do deep cleaning or whatever. And we'll just manage that on a day-to-day basis. And that's what we've been doing already.
And then the other clarifying, sorry, go ahead, Stephanie.
Oh, I was going to say, in relation to that point, in terms of managing staff shortages, with this approach, we can sort of level down if we need to. So if we don't have enough staff in a location to staff appropriately for computer access for the public, we can eliminate that for the time being and still do curbside at that location. So that way we just sort of step down in terms of staffing instead of closing a location altogether.
I think that's a wise movement. I think some of school corporations are looking at it the same way. Instead of closing K-12, what school needs to possibly be closed?
Any other questions around that?
I just have to compliment all of you, because it's a stressful time, and having to make these decisions like that, it's not easy. So thank you to all the staff. I don't care from what position they have, they're all a part of it, and they all make it work together as a team. So thank you.
They do. And I have to applaud the staff, because just in the last couple of days, I mean, we've asked them to really contribute a lot of information to help us make these decisions. And they've also been at the Indiana Library Federation conference virtually. So we've had,
Oh.
yeah, so they've been at a conference for professional development, and we've been pulling them back to help us with all this planning. So just a huge thank you to all the staff.
Good.
For helping us turn this so quickly.
Mhm.
It's unfortunate they're not in Hawaii for that conference.
Yeah, they'd be there for a while, wouldn't they?
Right. All right, do you have anything else, Denise, in your report?
No, that's it.
Okay. All right, thank you. Moving on to other business, the item that we had to add in was designating Denise as a purchasing agent for the library. Pete, do you just want to give us a little Cliff Notes version on this? I know it's related to our RFPs and things along those lines, but if you could explain, that'd be great.
Sure. The library for many years has designated the director as the purchasing agent. That designation comes into play for a number of reasons. And frankly, I didn't give it any thought when Denise was appointed interim director, but it has come to mind most recently as we've reviewed some RFPs. And under the Indiana purchasing statutes, the purchasing agent designation is important because that person, as the purchasing agent for the library, is required to make a written determination in certain instances. And in the case of RFPs, the purchasing agent makes the determination that the bidding process is either not practicable or advantageous to the library. And under those circumstances, using the request for proposal process is the proper procedure. So out of an abundance of caution, I think it's good for the board to designate Denise as the interim director, also as the purchasing agent, so that she can make that written determination in these cases where we have RFPs.
All right. Are there any questions on that? If not, I'll take a motion for approval.
So moved.
Second.
A motion by Gloria, second by Jim. And Sharon did message me that she had to step off for another call with the city, so I will call vote. Ben?
Yes.
Paul?
Yes.
Jim?
Yes.
Gloria?
Yes.
Marty?
Yes.
And Kent, yes. Sharon absent for that vote. All right, that motion carries. We've now reached, I guess we can't do public comment on doing it virtually like this, so. Go ahead.
Sarah had checked earlier and we had no email from Ask or through trustees.
Okay, wonderful, wonderful. On that note too, in mentioning Sarah's name, we did learn this past week that Sarah is moving on to other adventures. And so for those who don't know, Sarah helps support the board in a lot of ways as well, in addition to being the director's assistant. So thank you, Sarah, for your energy and time for the library over the years, and we wish you best in your next endeavor as well. So we appreciate all of that. All right, and with that, and with nothing else on the agenda, I would take a motion for adjournment.
So moved. Second.
Motion by Jim, second by Ben. I will call for a vote. All those in favor say aye.
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 Aye. Opposed, nay. All right, we'll see you next month in December. Have a good
Happy Thanksgiving. Happy Thanksgiving.
Bye-bye.
Bye-bye.
Bye.